Ventricles were hollow spaces in the brain, continuous with the central canal, filled with cerebrospinal fluid, lined with ependymal cells in order to circulate that fluid. The ventricles, there were two lateral ventricles, one on either cerebral hemisphere, a third ventricle in the middle of the diencephalon, and a fourth ventricle down between the pons and the midbrain. The fourth ventricle communicates with the subarachnoid space. Our cerebral hemispheres, the cerebral or cerebrum, makes up 80% of the total brain mass. It has elevated ridges called gyri, shallow grooves called sulci, and deep grooves called fissures. The more prominent sulci and fissures are in everybody, common in everybody. The longitudinal fissure separates the cerebral hemispheres. The transverse fissure separates the cerebellum from the cerebrum. The cortex, the cerebral cortex, is our executive suite. It is our area of consciousness. It had some areas. It had a primary motor cortex. It had a premotor cortex. It had Broca's areas. It had sensory areas. It had association areas, Gnostic areas, and Wernicke's areas, all specific areas of the brain. The cerebrum showed lateralization. One hemisphere dominates a task. The left side, language, math, and logic. The right side, visual and spatial skills and appreciation. The cerebral white matter, made up of myelinated tracts. The commissure fibers connect corresponding areas of the two hemispheres. Remember our corpus callosum, our downward turned C? Commissural fibers. Then there were association fibers that connect in the same hemisphere, adjacent gyri. Projection fibers enter or leave the cerebrum from lower brain and from the spinal cord. The basal nuclei involved in that start-stop motion. The diencephalon, made up of three paired structures, the thalamus, the hypothalamus, and the epithalamus. The thalamus sorts out sensory input and attaches a pleasant or unpleasant connotation. All sensory input passes through the thalamus on the way to the cerebral cortex. The thalamus also involved in emotional response, cortical arousal, learning, and memory. The hypothalamus, the floor of the third ventricle. The hypothalamus tells us what we need. The thalamus tells us what we like. The hypothalamus, the main homeostatic mechanism. Remember we said if you're guessing on neurology, always guess hypothalamus because it regulates our autonomic nervous system. It drives our emotional response, our sex drive, our fear, our rage, our pleasure. Regulates body temperature, tells us if we're full or thirsty or hungry. It regulates our sleep-wake system, our sleep-wake series. The epithalamus, the roof of the third ventricle, includes the pineal gland that secretes melatonin and the choroid plexus. The choroid plexus. The brain stem, made up of three parts, the midbrain, the corpora quadrigemina, and they are the visual or auditory reflexes. Midbrain. Remember midbrain, our crow, and the crow's backpack, corpora quadrigemina? Then the pons, conduction tracts, has the pneumotaxic and apnoistic breathing centers. The medulla oblongata. The medulla contains the centers, the cardiovascular, the respiratory, the vomiting, hiccuping, coughing, sneezing, and swallowing. The cerebellum. The cerebellum coordinates the precise timing and appropriate patterns for skeletal muscle contraction. Cerebrum, contralateral. Cerebellum, ipsilateral. The functional brain system, including the limbic system and the reticular formation, networks of neurons in the brain that work together but are very, very, very far apart in the brain. The reticular formation contains the RAS, reticular activating system. If we whack the RAS, we get coma. Higher mental functioning in our brain waves, our EEG patterns. We get brain waves like fingerprints. Alpha waves. Alphas we see when the patient is calm, relaxed, idle, but awake. Beta waves. Awake, mentally alert, problem solving. Theta waves, common in children, abnormal in the awake adult. Delta waves we see during sleep and during a dampened RAS. If the adult is awake, deltas indicate brain damage. Abnormal electrical activity is epilepsy, and there were 3 stages: mild, temporal, and the grand mal. Consciousness, there are 3 things involved in being conscious: perception of sensation, voluntary movements, and higher mental processing, all 3. Except for sleep, unconsciousness is always an impairment of brain function. Coma, total non-responsiveness to sensory stimuli. The sleep-wake cycles, a state of changed subconscious or partial unconsciousness, but not coma. We can be aroused from sleep, but not from a coma. There were 2 types of sleep: NREM, non-rapid eye movement, and REM, rapid eye movement, and we base those on the EEG. NREM had 4 stages, from just relaxation all the way down to deep, slow wave sleep. REM, a rapid eye movement, begins after NREM, usually around 90 minutes after sleep begins. We get a rapid backtracking on our EEG through 4 stages of alpha waves all the way back to stage 1. Most dreams occur in REM. Sleep, very, 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 very important. 16 hours a day for infants, 7 hours for young adults, and it begins to decline then into older age. Older people can't pass through stage 4 of NREM, so they become light sleepers because they can't get through stage 4. Narcolepsy, involuntary lapses into sleep. Insomnia, chronic inability to go to sleep. Memory, there are stages of memory. There's short-term memory and long-term memory. Short-term memory is the first step to long-term memory. And remember, there were things that helped us move from short-term to long-term. And we talked about how I teach: emotional state, rehearsal, association, and some automatic memory. There were categories of memory: fact memory that can be forgotten really quickly, and skill memory that's less conscious level. The more places we can stick a memory, the easier it is for us to pull them back. How do we protect our brain? We protect it with the meninges, the cerebrospinal fluid, the blood-brain barrier, and the bones, the skull. The meninges are the membranes. There was 3, the dura mater, the arachnoid mater, and the pia mater. Dura mater is on the outside. The dura makes 3 folds: falx cerebri into the longitudinal fissure, falx cerebelli separates the 2 cerebellar hemispheres, and tentorium cerebelli puts a tent. It separates the cerebellum from the cerebrum. Cerebrospinal fluid protects our brain. It cushions it, it nourishes it. Cerebrospinal fluid is a filtrate of plasma. Your discussion question will be: describe the formation, circulation, and resorption of cerebrospinal fluid. I gave you a handout for it. Do we need to go over that? Beginning in the lateral ventricles, the choroid plexus in the roof of each ventricle forms the cerebrospinal fluid. Beginning in the laterals, it passes from the lateral ventricles through the foramen of Monroe into the third ventricle. From the third ventricle, it passes down the aqueduct of Silvis into the fourth. In each ventricle, more fluid is added. Into the fourth ventricle, there are 3 openings in the roof of the fourth ventricle that allow the cerebrospinal fluid to exit out into the subarachnoid space, where it circulates around the brain and spinal cord and gets resorbed by the arachnoid villi. The blood-brain barrier, how we keep blood out of our brain. Blood-brain barrier is given to us by astrocytes. Blood-brain barrier given to us by astrocytes. Traumatic brain injury. We had a coup and a contra-coup. The coup where we hit the head, the contra-coup on the opposite side. We can get concussion, slight injury, mild and short-lived symptoms, contusion, marked tissue destruction, a variety of symptoms. Subdural and subarachnoid hemorrhaging, where it bleeds into the subdural space or into the subarachnoid space. The cardiovascular accident, CVA, commonly called a stroke, third leading cause of death, commonly called a stroke. Blood circulation is blocked, causing ischemia, and that starves the cells downstream. 80% of people die on the first attack. The remaining 20% have some form of disability. A TIA, where the patient has a short-term symptoms of a stroke, but it clears. Some degenerative brain disorders, Alzheimer's. Alzheimer's was a deficit of acetylcholine. Parkinson's, degeneration of the dopamine-releasing neurons of the basal nuclei. Remember our symptoms of the Parkinson's guy? Pill roller, loss of facial expression, doesn't swing his arms, shuffling gait, loss of facial expression. Parkinson's. Huntington's disease, a hereditary dominant, where the patient winds up as a shaking mass in about 15 years. The spinal cord begins at foramen magnum and runs all the way down to L1, L2. In the adult, there were 31 pairs of spinal nerves that exit from the vertebra. The cross-sectional anatomy. Remember, we drew a cross-section of our spinal cord, and we had the whole thing all hooked up. And remember our DRG, dorsal root ganglia? And we said that made it the